Dr. Douglas Robinson, Campbell Podiatry. Such a common problem. Calluses that just don't go away. They're not mechanical and they get bigger and bigger because they're probably not calluses. They're not corns, not calluses. They're an infection and it's caused from the human papillomavirus and they're called verruca. They're also known as plantar, meaning the bottom of the foot, that's its location, warts. So this person thought he just had calluses, but indeed he's got verruca and he's got a series of them. And when you've got one, we call that just an isolated wart. And there is, if the normal skin lines are like this, you lose the definition or the lines. That's usually a wart. We also see little dark areas, little red or black or brown areas. Those are called rete pegs. So this is like a bird's eye view looking at the bottom of the skin. Notice that the skin line gets interrupted right here. That's the wart. And if you look at the side view of a wart, our skin has two layers. The outer layer is called the epidermis. The layer deep to that is called the dermis. And then below this is fatty tissue, and below that is muscle and bone. The epidermis is where this resides. So it can look like this from the side view. Again, this is a bird's eye view, this is a side view. But sometimes you're just seeing the tip of the iceberg, which is that disruption right here, and it's a lot bigger underneath. So as we start to treat this, and this comes more up towards the surface, sometimes the next visit is like, wow, it's bigger. That's because the widest part of it is starting to go up towards the very top. So it looks like it's getting bigger, but it's getting more superficial. So it's an infection called human papillomavirus. All of them on the feet are benign. It's also known as verruca. It's kind of like verruca salt from Willy Wonka. You know, she wasn't very nice and these aren't very nice. They don't go away with help. So the treatment for these humble things that seem like a callus but are not is if they're 5 millimeters or less, we treat it with the topical. That's called Beetlejuice. It's a trifecta medicine. It's got salicylic acid, cantharidin, and podophyllin. And the cantharidin is derived from the blister beetle, so we call it Beetlejuice. And that desiccates the wart. If it's 5 millimeters or less, if it's 5 millimeters or 6 millimeters or more, usually that doesn't work really well, or you have to keep coming back and back and back to get this to go away. And the way that we take care of it, if it's that big, on an adult, not on kids, is we inject it with a medicine called bleomycin. Bleomycin is also a desiccant, but when I use this, I first numb you up, and then I can put it all throughout this area. It does not hurt at all after I get you numbed up. It takes about 10 minutes for it to get adequately numb. And it desiccates this. After I shave it down, then I put the medicine and I infiltrate this area. I pepper it with that medicine. And then over the course of a month, it brings this up towards the surface. It's usually not one and done. Usually you take several of these and they're done 1 month apart. So the humble wart is going to stay humble and spread. So if it started out with one of these and you don't address it, you can get one that shoots out this way, one that shoots out this way. Those are called satellite warts. And if you have a cluster of them all in one area, plus these are called mosaic warts. They don't go away. They're highly contagious. Highly recommend you're not barefoot in the house because on surfaces that are moist, like in the bathroom, which many people will contract them in the bathroom on aggregate around pools, you will spread them. And you can get more of these. So best not to be barefoot. So this is how we take care of warts. And right away after doing this, I usually have you use a little aperture pad around this. So when you step down, the pad will bear the load instead of the wart, so we can keep you pain-free. So we have a pad that will go around this area, either in the shape of a U or one that's a complete circle to float this area. And that's how we address warts. I'm Dr. Douglas Robinson. Please take care of yourself and each other.